Next, that is pathophysiology of your diabetes mellitus. In pathophysiology, first, that is, so insulin is the principal hormone that regulates the uptake of glucose from the blood into the cells. That is insulin. Insulin is the main hormone which is helpful or which regulates the uptake of glucose from the blood into the cells of body, especially for liver, adipose tissue and muscle, except smooth muscle, in which insulin acts via the IGF-1, that is insulin like growth factor. I am repeating what I am saying. This insulin is the main hormone or the principal hormone or which regulates what? It regulates the uptake of glucose in various uptake of glucose from the blood into the cells of body, especially liver, then adipose tissue and muscles, except the smooth muscle. Then therefore the deficiency of insulin or the insensitivity of its receptor, it play a major role in all form of diabetes mellitus. I am repeating, see here, it is important. Therefore, because of this, what will happen? There is the deficiency of insulin or the insensitivity of receptor. It plays an important role in all form of your diabetes. Then basically the body obtains the glucose from main three sources or main three places. First, that is the intestinal absorption of food. Second, breakdown of glycogen. So what is glycogen? It is a storage form of glucose which is found in the liver. And third, that is glucogenesis. Glucogenesis is what? It is a generation of glucose from non-carbohydrates or the different non-carbohydrate substrate in the body. I am repeating, there are three main sources. First, that is intestinal absorption of food. Second, breakdown of glycogen. So what is glycogen? It is a storage or the storage form of glucose. It is a storage form of glucose which is found in the liver. Then third, that is glucogenesis, the generation of glucose or the production of glucose from non-carbohydrate substrate in the body. Then this insulin is important, or it plays important role in balancing the glucose level in the body. Yes, what is the role of this insulin? It plays an important role for balancing your glucose in the body. Then second, it can inhibit the breakdown of glycogen or the process of glucogenesis. Yes, what is glucogenesis? It is a generation of what? Generation of glucose or the production of glucose from non-carbohydrate substrate. It is nothing but glucogenesis. It means this insulin or it can inhibit the breakdown of glycogen or the process of glucogenesis. So what is glycogen? It is a storage form of glucose and which is found in the liver. Then next, it can stimulate the transport of glucose into the fat and muscle cells. Then next, it can stimulate the storage of glucose in the form of glycogen. Then insulin also important for, yes, these are the few roles of this glycogen. Then insulin is released into the blood by a beta cells and which is found in the islet of Langerhans in the pancreas. I am repeating, this insulin is released into the blood by the beta cells and which is found in the islet of Langerhans in the pancreas in response to rising or increasing the level of blood glucose, basically or typically after eating. Then lower glucose level which results or which cause decreased insulin release from a beta cells and results in the breakdown of glycogen to the glucose. See here, this lower or lesser the blood glucose level, which results in or which causes decreased insulin release from what? From beta cells, and which cause or due to this decreased insulin release from beta cells, what will happen? There is which results in breakdown of glycogen to the glucose, and this process is mainly controlled by the hormone that is glucagon, which act in the opposite manner to insulin. Yes, this all process is mainly controlled by which hormone? That is name of hormone, that is glucagon, which act as a opposite manner to the insulin. Then next, if the amount of insulin available is insufficient, then if cell respond poorly to the effect of insulin. If insulin itself is defective, then the glucose will not be absorbed properly by the body cells. Due to this improper absorption, there is indirectly or net effect is persistently high level of blood glucose. Then poor protein synthesis and breakdown of fat storage, it causes acidosis. Then when the glucose concentration in the blood remain high for a longer period of time, then the kidney will reach threshold of reabsorption, that is glycosuria. Yes, if blood glucose level or the glucose level in the blood is high for a longer or for a longer period of time, then it causes reabsorption. Then due to this increase the osmotic pressure of the urine, that is then it causes polyuria, and due to this increased fluid loss. Then the lost blood volume will be replaced osmotically from a water held in the body cells and also other body compartment. Due to this dehydration and loss, it is polydipsia. I already told you the meaning of this polydipsia in small. Then in type 1 diabetes, the type 1 diabetes is characterized by what? The loss of the insulin, and this insulin which is produced by beta cells. It is characterized by this type 1 diabetes is characterized by what? The loss of insulin producing a beta cells of islet of Langerhans in the pancreas, leading to a insulin deficiency. This type can be classified as immune mediated or the idiopathic. It means unknown cause. Then the majority of type 1 diabetes is of immune mediated nature, in which the T cell mediated, that is autoimmune attacks leads to the loss of beta cells, and due to the loss of beta cells, what will happen? Automatically the loss of your insulin. It means these beta cells which are responsible for producing what? Producing insulin. If these beta cells are lost, if there is loss of beta cells, automatically there is loss or the deficiency of your insulin. Then second, the most affected peoples are otherwise healthy and of a healthy weight when onset occur. Then the sensitivity and responsiveness to the insulin are usually normal, especially in the early stage. Then this type 1 diabetes can affect in children or the adult, but was traditionally termed juvenile diabetes because of this majority of this diabetes causes were in children. Then second, type 2 diabetes, it is characterized by or it is called as insulin resistance. This defect, the defective responsiveness of body tissues to insulin is believed to involve insulin receptor. In the early stage of this type 2 diabetes, the predominant abnormality is reduced insulin sensitivity. And this type 2 diabetes are because of first, that is lifestyle factor, and second, that is genetic. A number of lifestyle factor, for example, obesity, lack of physical activity, poor diet, stress. Then dietary factor also influence the risk of developing type 2 diabetes. For example, or such as in dietary factors such as sugar sweetened drink. Then type of fats in diet, for example, saturated fats and trans fatty acids increased the risk. Then polyunsaturated and monounsaturated fat decreasing the risk. I am repeating here, these saturated fats and trans fatty acids are increasing the risk, and polyunsaturated and monounsaturated fats decreasing the risk. Then eating a lots of white rice also may increase the risk of diabetes. Then lack of exercise is a 7% cause of your diabetes. Then third, that is gestational diabetes, that is third type. This diabetes involves the combination of relatively inadequate insulin secretion and responsiveness. I am repeating, it involves the combination of what? Combination of relatively inadequate insulin secretion and also the responsiveness. Then third, it occurs about 2 to 10% of all pregnancies and may improve or disappear after delivery. Then however, after a pregnancy, approximately 5 to 10% of women with this diabetes are found to be or mostly commonly type 2 diabetes. Yes, this third type of diabetes, it is fully treatable but requires careful careful medical supervision throughout the pregnancy. Then for the management of this diabetes, it may include dietary changes, then blood glucose level monitoring, and in some cases insulin may be required. Then the risk of this third diabetes, it includes macrosomia, it means high birth weight, then congenital heart defects, then central nervous system abnormalities, and third, that is skeletal muscle abnormalities. Then the increased level of insulin in a fetus blood may inhibit the fetal surfactant production and also cause a respiratory distress syndrome. And this high blood bilirubin level, it may cause or it results from a destruction of red blood cells. Yes, this increased level of bilirubin, it causes destruction of your RBCs, that is red blood cells. Then manifestation and complications, first, that is periodontal disease, first, that is microangiopathy, altered antigenic challenge, second, altered cell mediated immune response and impaired of neutrophil chemotaxis. Then increased calcium and glucose leads to plaque formation and increased collagen breakdown. Then for diagnosis, first, that is fasting plasma glucose level. Then here we can see your normal values. Then oral glucose tolerance test, OGTT, that is oral glucose tolerance test. Measure the body's ability to metabolize glucose, most commonly done to check a gestational diabetes. Then the patient is asked to take glucose drink and their blood glucose level is measured before and at the interval after surgery. Measured after the sugary drink is taken. Then for the standard glucose tolerance test, we should drink 75 gram or the 100 gram. Then for treatment or management, first that is lifestyle modification, second good nutrition, then regular exercise, then diet control and maintain your blood pressure, then use of anti-diabetic drugs, that is use of medications, and third that is surgery for that is for pancreas transplantation, then kidney transplantation and weight loss surgery. So this is all about your diabetes mellitus.